How anabolic steroids misused. Anabolic steroids are frequently misused for non-medical purposes, particularly in the realms of athletics and bodybuilding, to enhance muscle growth, strength, and physical performance. Misuse of anabolic steroids involves several common practices. Steroid cycling. Users typically engage in cycles of steroid use, where they take multiple doses of steroids over a specific period, for example, 6 to 12 weeks, followed by a period of abstinence to allow the body to recover. Stacking. This involves combining different types of steroids, for example, testosterone, nandrolone, stanozolol, to maximize muscle growth and achieve specific goals. Stacking may also include other performance-enhancing drugs or supplements. Pyramiding. Some users employ a pyramid approach, where they gradually increase steroid doses to a peak level and then taper down to lower doses. This method is believed to minimize side effects. Injection or oral administration. Anabolic steroids can be administered via injection, intramuscular, or taken orally, tablets or capsules. Injectable forms are often preferred for their direct impact on muscle tissue. Supraphysiological doses. Misusers often take doses of steroids that exceed medical recommendations, aiming to accelerate muscle growth and performance gains. This can lead to serious health risks and side effects. Cycle stacking with other substances. Some individuals combine anabolic steroids with other substances, such as growth hormone, insulin, diuretics, or stimulants, to further enhance muscle growth or alter body composition. Avoiding detection. Athletes and others subject to drug testing may misuse anabolic steroids by using strategies to evade detection, such as timing their use to coincide with clearance from the body or using designer steroids that are less likely to be detected in standard tests. Misuse of anabolic steroids is associated with a range of adverse effects and health risks, including cardiovascular complications, for example, hypertension, heart disease, liver damage, for example, liver tumors, jaundice, hormonal imbalances, for example, infertility, gynecomastia, psychological effects, for example, aggression, mood swings, and dependence. Long-term misuse can lead to serious health consequences and is considered illegal in many countries without a prescription. It's important to emphasize that the use of anabolic steroids should only occur under medical supervision for legitimate medical purposes. What are the side effects of anabolic steroids? The use of anabolic steroids, especially when misused or abused, can lead to a wide range of adverse effects and potential health risks. Some of the common side effects associated with anabolic steroid use include cardiovascular effects, increased risk of heart disease and stroke, elevated blood pressure, hypertension, changes in cholesterol levels, including decreased HDL, good, cholesterol and increased LDL, bad, cholesterol, increased risk of blood clots, hormonal effects, hormonal imbalances, including decreased natural testosterone production, hypogonadism. Men may experience testicular atrophy, shrinkage of the testicles, and reduced sperm count, leading to infertility. Women may develop masculine characteristics, virilization, such as deepening of the voice, facial hair growth, and menstrual irregularities. Psychological effects: mood swings, irritability, and aggression, often referred to as roid rage. Increased risk of psychiatric disorders, including depression and anxiety. Substance dependence and withdrawal symptoms upon discontinuation. Liver damage. Anabolic steroid use can cause liver damage, including liver tumors and a condition called peliosis hepatis, blood-filled cysts in the liver. Musculoskeletal effects. Premature closure of growth plates in adolescence, leading to stunted growth. Increased risk of tendon injuries due to muscle imbalances and strength gains that exceed tendon capacity. Skin and hair effects. Acne and oily skin. Male pattern baldness, androgenic alopecia, in both men and women. Other effects: fluid retention, edema, and swelling. Increased risk of tendon and ligament injuries due to muscle hypertrophy and strength gains. Increased risk of infections due to injection practices, if using injectable steroids. It's important to note that the severity and likelihood of these side effects can vary depending on factors such as the dose, duration of use, individual susceptibility, and underlying health conditions. The non-medical use of anabolic steroids is illegal in many countries and can have serious consequences for health and well-being. Anyone considering the use of anabolic steroids should do so only under medical supervision and with a thorough understanding of the potential risks involved. Can anabolic steroids be used safely? Anabolic steroids can be used safely when prescribed by qualified healthcare professionals for legitimate medical purposes and under proper supervision. In medical settings, anabolic steroids are used to treat specific conditions such as hormone deficiencies, muscle wasting diseases, and delayed puberty. When used appropriately, the benefits of anabolic steroids can outweigh the risks for certain patients. Key considerations for safe and responsible use of anabolic steroids include medical supervision. Anabolic steroids should only be used under the supervision of a healthcare provider who can monitor their effects, adjust dosages as needed, and assess potential risks. Prescription only. Anabolic steroids should be obtained legally through a prescription from a licensed healthcare professional. Non-medical use, such as for athletic performance enhancement or bodybuilding, is illegal and unsafe. Proper dosage and duration. Healthcare providers prescribe anabolic steroids at appropriate doses and for specific durations to minimize side effects and health risks. Regular monitoring. Patients using anabolic steroids for medical purposes should undergo regular monitoring of their health, including blood tests to assess hormone levels, liver function, lipid profiles, and cardiovascular health. Adherence to guidelines. Patients should follow their healthcare provider's instructions regarding the use of anabolic steroids, including any dietary or lifestyle recommendations to mitigate potential side effects. It's important to note that the misuse or abuse of anabolic steroids, especially in high doses and without medical supervision, can lead to serious health complications and adverse effects. Misuse of these substances for non-medical purposes is associated with increased risks of cardiovascular disease, liver damage, hormonal imbalances, psychiatric disorders, and dependence. Individuals who are considering the use of anabolic steroids should consult with a healthcare provider to discuss the potential risks and benefits, explore alternative treatment options, and ensure safe and responsible use if medically indicated. Healthcare professionals play a critical role in educating patients about the proper use of anabolic steroids and monitoring their health to minimize potential harm. Are anabolic steroids illegal? The legality of anabolic steroids varies by country and jurisdiction. In many countries, anabolic steroids are classified as controlled substances due to their potential for misuse, abuse, and serious health risks when used improperly. Here are some key points regarding the legal status of anabolic steroids. Prescription requirement. In most countries, anabolic steroids are classified as prescription medications, meaning they can only be legally obtained with a valid prescription from a licensed healthcare provider. This is to ensure that steroids are used appropriately for legitimate medical purposes and under medical supervision. Non-medical use. Using anabolic steroids for non-medical purposes, such as athletic performance enhancement or bodybuilding, is generally considered illegal and constitutes drug abuse. The unauthorized possession, distribution, or sale of anabolic steroids without a prescription is against the law in many countries. Regulatory agencies, such as the U.S. Drug Enforcement Administration, DEA, and similar bodies in other countries, monitor and enforce laws related to controlled substances, including anabolic steroids. They classify these substances based on their potential for abuse and medical utility. Penalties for violations. Violating laws related to anabolic steroids can result in legal consequences, including fines, imprisonment, and criminal charges. Athletes who use steroids without a legitimate medical prescription may face sanctions and bans from sports organizations. International regulations. Anabolic steroids are subject to international regulations, such as those outlined by the World Anti-Doping Agency, WADA, which prohibits the use of steroids in sports competition without a therapeutic use exemption, DUE, obtained for legitimate medical reasons. It's important for individuals to be aware of the legal status of anabolic steroids in their respective countries, and to comply with applicable laws and regulations. Misusing or illegally obtaining anabolic steroids can have serious legal and health consequences. Anyone considering the use of steroids for medical purposes should do so under the guidance of a healthcare professional and in accordance with legal guidelines.